And sometimes, if you're doing something, is that really going to cause you additional harm? Not per se. However, it is your body telling you that you're not getting the proper pressure management through here, because now you're having the pressure on the inside of your stomach, on the inside of your abdominal region, pushing out against that wall, even though it is softer and squishy, okay? So if you notice that doming, let us know, so we can try to help you modify so we can get better core engagement. Also, what most people will notice, what most people see when they pull up pictures online, how everything kind of sinks in. And that sinking in itself, that is that thinning of the linea alba. So if you're noticing sinking in, that means things are not closing. So we'll be doing different things that way you can actually see how to get better closure with that. So 2 things you're looking for: doming and sinking in, because that means pressure somehow is not managed well, or we're not getting proper activation. All right, so first what we're going to do is we're just going to focus on our breathing. So, yep, different position. Relax the shoulders, close your eyes if you need to, just don't fall asleep. Just don't fall asleep. So close the eyes if you need to. Slow, deep breaths. We're just going to walk around just to kind of see how everyone's breathing. So at home, if you're doing this, if you're sitting down, same thing, allowing for the tummy to expand out, allow for the ribs to push out and the back also to push back. If you're laying down and doing this, what we want to happen is you want to feel your back pushing into the ground. And you also still want to be able to see the tummy rise and fall with your ribs moving out to the side as well. Good. So slow, deep breaths. The jaw should be unclenched, so the tip of the tongue at the roof of your mouth. And we're just taking a look to see how everyone is breathing. We're straight belly breathing right now. So give her a cue, add a little bit of compression through here. You see how her ribs drop down? Yes, we're going to work on fixing her rib flare, because we need to be able to get these ribs a little bit more. So with that cue itself, we automatically got better rib movement. So just give her just a little slight bit of compression through there. Good. And you can adjust position if you need to as you are breathing.
Start from breathing out.
All right. How are we feeling?
You
can sit up. You can sit up. You can sit up and take a break. Sit up and take a break. Sit up and take a break.
Like right.
Yeah, sit up and take a break. Yeah, sit up and take a break. So, especially with being 6 weeks postpartum, when you go to sit up, rather than coming straight up, roll to your side still. Yep, still roll to your side. Yeah, it'll put less stress and less tension on here. So if you are pregnant and you are watching this, if you are laying down on your back, yes, during pregnancy at certain points you can do exercises on your back. There's certain signs you want to be aware of. So if you start feeling lightheaded or dizzy, I want you to move. You start noticing that you have a headache, then you need to get off your back as well. But for short durations of time during pregnancy, you can be on your back. However, make sure you're rolling to your side to get up, and same thing when you're freshly postpartum as well. We want you to be able to roll to your side to get up, just to put less stress on your back and also on your abdominal region. Awesome. All right, so right now, so far, how's everyone feeling? Okay, everyone feel like they have a good idea as to where they're starting off right now. Okay, so just some different things that we've noticed, that because each one is going to have to be targeted a little differently, so I just ask for your patience as we go around, because some people do have a rib flare, and a rib flare pretty much means that right through here, this angle through here is greater than 90 degrees. I would expect that. Why? Because you've had babies. And where do the babies sit? They sit right through here, and yes, that actually can change your rib position itself. So we're going to work on with some people trying to bring the ribs down and in, using more so of the lateral muscles, specifically your external oblique muscles. And we're also going to work with some individuals on trying to better activate the transverse abdominis and the pelvic floor below, so we can get more control through this area. And for some, we may do a little bit of everything, okay? So at the beginning, it is important to start off with the basics, because what happens is people try to jump too quickly into doing crunches and planks and side planks and all that stuff, and they don't have the proper muscle engagement. So if you don't have the proper muscle engagement, you're pretty much going to do more harm than good at this phase, okay? All right, so you can stay sitting up. What we'll do is we'll allow for you all to lay down when we come over to you, but you can stay sitting up. So at home, if you've noticed that you have more separation through here and also less tension through here, it could be because your ribs itself. If your rib angle is greater than 90 degrees, then what we need to focus on is bringing your ribs down and in. In order for you to do that, I want you to actually lay down on your back, and you're gonna bring both hands in front of you, keeping the shoulders relaxed, pushing the shoulders forward, and then holding for a count of 10 and relaxing. So it's a very subtle movement. Pushing the shoulders forward. Make sure you don't hike the shoulders up, but pushing those shoulders forward, holding for a count of 10 seconds, and then relaxing off. This here is working a muscle called your serratus anterior, and the muscle with the serratus anterior actually attaches to your ribs, which will help the ribs to move in and indirectly work those external obliques. So while you at home work on that, we're gonna walk around just a bit here. All right. You knew I was coming straight for you. So relax the shoulders, brother. All right. Right through here. All right, so what I want you to do is take a nice deep breath in for me. And on the exhale, push your shoulders forward. Good. You saw that through here automatically, and come on down. Now do it without clenching your glutes. Good. Good. All right. So have her do that about 10 times, and then you can add in like a 5 to 10 second hold. And then what you can do is you can reassess up through here with that serratus engagement. All right, my dear. Let's see where we are. All right, and I know for most of, right, that was for you, it's right there, towards the umbilical region and down below. So if you're noticing down below, we're gonna work on getting your pelvic floor a bit more engaged. So, so pelvic floor being a bit more engaged is important because it will help to indirectly activate the deeper core, your transverse abdominis, and that muscle also makes a muscle on the back activate as well, okay? All right, so I'm just gonna place my hands right through here. And first one, I'm gonna figure out what cue works for you as far as getting your pelvic floor. Do you know how to do a cable?
No.
Okay.
I've tried, but I don't know if I did it right.
Okay, yeah, no worries, no worries. So I want for you just to stay nice and relaxed, just nice deep breathing, deep breath in, and exhale. Okay. So what we should notice on the exhale is a little bit of the transverse abdominis, so a little bit of the muscles down through here kicking in, which also would allow for your pelvic floor to kick in. Very little kicking in right now, but that doesn't surprise me at all, especially when we have a bit more laxity through here. So now we're gonna work on trying to get that 2 better kick in.
Okay.
All right, so I'm gonna put this out there. Everyone cheats, okay? Everyone's body cheats because our body has to be able to compensate so we can do different things. So if I give you a cue, please, I just don't get frustrated. You can get a little frustrated if you're like, wait, I thought I was doing it, but we're just gonna try as best as we can to get through it, okay?
Okay.
All right, what you're gonna do is in just a moment, not yet, you're gonna take a nice deep breath, and on the exhale, I want you to try to hold the stream of urine. So you're gonna imagine that you're trying to stop your pee. Please don't do this in real life when you're on the toilet.
Okay.
Please, so yes, at home, this is just a cue. Please don't do that in real life.
Okay, on the exhale.
Get on the exhale. Don't hold your breath. It's hard, isn't it? Okay, and relax for me. Okay. All right, so now let's see if I give you a different cue. Same muscles, but sometimes people get a better response when you activate more so the posterior fibers first compared to the anterior fibers. So now you're gonna do the same thing. It's gonna be a deep breath, but now I'm gonna try to have you hold the gas in.
Okay.
Congratulations. You know how to breathe. Good, on the exhale. We got a little bit more.
Okay.
Good, good. Are you okay if I place my hands right here on the
Yeah,
bottom?
that's fine.
All right.
Turn over?
No, you're fine right
Okay.
here. You're fine right here. All right, so same thing for me. I want you to take a nice deep breath. Good. And on the exhale, try to hold the gas. And relax.
Not really, no.
Okay. All right, just asking, because the muscles at first pushed and then they relaxed. I was like, oh. Okay. All right, go ahead, take a nice deep breath for me. And exhale, hold the gas in. Okay, all right. So I actually know how I want to start with her. So with her, let's start off. We want to try to better get the pelvic floor engaged. So we want to try to do some breathing. So let's bring a chair over. We'll have her sit in the chair. Let's do some breathing, and on the exhale, we want to try to see if we can get that perineum, exactly, to lift up. So each time you take a deep breath, you should expect for on the inhalation for your pelvic floor to drop down. Each time you exhale, you should naturally expect for the pelvic floor to lift up a little bit. So your exercise first is actually going to be starting off re-engaging those pelvic floor muscles so that way you can become more acquainted with it. So we're going to have you come take a seat in this chair. That's just going to instruct you on that. And then we can reassess in a recline position. All righty, hon. All right, so you are 6 weeks postpartum. Congratulations.
Thank you.
Boy or girl?
Boy.
Oh, congratulations. So with you being 6 weeks postpartum, it's a gentle progression, okay? So with the 6 weeks, biggest thing you want to understand, your muscles are still recovering. Your body is still pretty much recovering. You also probably are sleep deprived, okay? So with you being sleep deprived in itself, that can also affect how your muscles are responding and working. Are you breastfeeding?
So good
Okay,
here.
and that as well. So that's just good information to know, okay? Alright, so first thing we're gonna do, get your breathing properly in this position, okay? Check out your breathing. Yeah, okay. Alright, go ahead and take a nice deep breath in from me.
Okay.
Oh, you felt your chest rise first?
Yeah.
Okay, so what we want to happen is, we want for actually the diaphragm to drop down, so we should get some belly and also some of the ribs, not just the chest moving up, okay? Alright, so I want you to take a deep breath in all the way into my hands. Better, good, and exhale.
I'll have people sit on a towel. That way it gives you that extra cue.
Good. Deep breath in.
If it's okay with you.
Good. Deep breath in.
Like, girl, you ain't just playing.
It's hard work, but you probably
All right, so now what we're gonna do with you is, because we have the breath work going, we have the pelvic floor indirectly responding. Now I'm gonna help you activate the pelvic floor with your breathing, okay? So in order to activate the pelvic floor with breathing, we're gonna do the same thing that we did before. On the inhalation, you're actually gonna allow for things to relax off. On the exhalation, you're gonna gently try to hold in the gas or hold in the flow of urine. We'll see how things work with that. If not, we'll try a different cue, okay? All right, deep breath in.
It's going, okay.
Good.
So how do I make it stronger? Like just.
Good. And you felt down here drawing a bit as well?
Am I supposed to
All right,
just
go ahead and
clench
take a deep
something?
breath in.
Okay.
Good. And exhale. Good. You should, where my son goes, I'm always on. Always. Deep breath in. And out.
Okay, I think I felt more that time.
Good. All right. So now for me, in addition to you trying to hold the gas in, on the exhale, you're also going to gently try to engage. You're going to try to gently pull the belly button in as well, okay?
Okay.
So deep breath in. And exhale, gently pull the belly button in. So you felt how when you wanted to pull it in, you started crunching up here?
Yeah.
So it's a very subtle motion, okay? You don't have to try to get these muscles up here engaged, because what I don't want you to have, I don't want these muscles to start gripping, and then these muscles down here never do any work, okay? Deep breath in. Good. Exhale. Gently pull right there. Don't pull anymore. Felt the difference? Perfect. All right, hon, you're going to be working on that, and then we're going to reassess.
Okay.
How did it look after this?
My brain's responding a lot better.
Good. Good, yo, we got to get you moving.
Okay, let's try.
All righty. You already got it straight where I was. I'm so sorry. It doesn't hold down. Put the hands on the sides. All right, deep breath from me. Good. Exhale, gently pull the belly button.
I like to keep the hands here and here.
Just
so
good.
you have
Good.
that feedback.
Good.
So you have
Deep breath. Good. Gently pull the belly button.
Oh, sorry. Let's start over.
Good. You've been practicing. Good. Go ahead and bring both arms up, because now I'm making you do things combined. Relax the shoulders. All right. So now what you're going to do for me is going to still take that nice deep breath. Good. Exhale, gently pull the belly button in. And push with the shoulders.
I'm doing it right.
Good. And relax. Good. So don't crunch through here. You have to just thrust just the shoulders forward. Good. Deep breath. Exhale, belly button straight as punch. Good. And relax. Good. Exhale. Good. All right.
I'm doing it. I thought I was doing it, girl. I was like, I think I'm doing something different this time.
And let's say I want to show you this over here. Good. All right, so we see around the belly button. All right, so everyone knows their starting point. Everyone's, all right, so we have our serratus punch over here, so we get the ribs down. We have our breath work over here, getting the pelvic floor more engaged. Breath work as well, because things, you're still taking it slow. I'm going to continue to emphasize that, okay? The snapback culture is a lie. It is a lie. It causes more harm. Don't do the snapback. And my dear, you already know, we're working on serratus and also on that deeper core as well. Let's take it to hands and knees.
Oh, okay.
Yes. All right, so what we're going to do in this position here, first we're going to work on just trying to improve the upper back mobility. So we're going to do a common yoga move itself. So what you're going to do for me, we're only going to do part of it, especially right here, 6 weeks. I don't want us putting too much stress on the front of the tummy. But on the exhale for me, you're just going to round the shoulders and imagine you have a string at your upper back, pulling that upper back towards the ceiling. So inhale nice and deep. And if you're focusing on breathing, you should feel the breath all the way down to the pelvic floor. Keeping those shoulders relaxed. On the exhale, rounding the shoulders. And you're just going to continue to breathe. Please don't hold your breath. Good. And taking about 3 to 4 nice slow breaths and then relaxing off of that there. So just so we can get the upper back moving. All right, so go ahead and take a nice deep breath in for me. Even at home, take a nice deep breath in. On the exhale, go ahead and gently push the top of your back towards the ceiling. Don't allow for those shoulders to raise up towards your ears. Let's see. You feel my hand right through here? Try to push this part of your back all the way up. That's hard, huh?
Yes.
And relax. Good. All right. Go ahead and gently deep breath in and on the exhale. There you go. All right. So with this here, this will tell you if you have limitations or restrictions itself with your upper back. If your upper back is not moving well, you're not going to be able to get the appropriate breath that you need, which means that you're not going to be able to get the appropriate core activation or activation of your pelvic floor. So this is the step 1 portion of this exercise. Step 2, if you are working on trying to improve getting the ribs down, what you can do with step 2 is same thing now for me, except now we're going to leave the upper back nice and still. On the exhale, deep breath in, exhale, pushing. Now I'm doing my serratus punch into the ground, so I'm actually pushing my shoulders forward, okay? And as I do that, I'm going to hold the position, but not hold my breath. All right, so let's go ahead and see.
Yeah, I don't know what I'm supposed to be doing.
Yeah, I'm coming. I saw the eyebrows. So you have to right here, nice and relaxed. Good. And you can just let the head just go to relaxed position. Perfect. All right. Bring your arms back a little bit. That should help. There you go. All right. So deep breath in. Good. On the exhale, now push the shoulders forward. Good. Don't round. There you go. Stop right there. And now relax. Good. Perfect. So this serratus punch, there we go. So with this one here, it should not be down in the low back, so you should not feel the low back arching either way, but it should be straight at the shoulders.
Oh. Yeah, I was going to hold back. Okay. Let's see.
And it's a very subtle movement. It is a very subtle movement, especially because a lot of us have a good amount of serratus weakness as well. Move your hands back. Try to get your hands direct underneath the shoulder. Good. All right. So we have that. So now we're going to progress it even more. And it is okay with these progressions. If your body says, nope, I'm taking it back, okay? That is okay, because when you're doing something, especially when you're working on trying to correct the mechanics behind it, it can be not just physically exhausting, it also could be mentally exhausting, because it can be very frustrating at times. So if you have to take that mental break, take it. Okay? Even if you have to close the door, take a mental break from family. Take it. Take that too.
Doctor's orders.
You can say doctor's orders. Doctor said I have to go in my room with the light off, dark, nice candle. There you go. Doctor's orders. There it is. All right. So now we're going to do the same thing. Hands and knees. You're going to do that serratus punch to push the shoulders forward. And now supporting that position, you don't want to lose it, so you don't want the body to collapse. Lift one arm up. Notice my shoulder stayed. My shoulder didn't drop down at all. Now, it is not uncommon for people to tell me, I can't do that. And that is okay. That's telling me what we need to work on. And this is what we're trying to see. Coming on. Relax it. There you go. felt yourself sink a little bit? Okay. Yep, so that's saying that we have to work a bit more on that serratus endurance.
So
So,
we're supposed to keep it?
yep, supposed to keep that there. Good. Don't hold your breath. Yep. So come back down and relax.
Do I need to be concerned with how high I can bring my arm up?
Right now, no. No, right now, no. Yep, so don't hold your breath. Focus on breathing, keeping that serratus punch. And then just let them just, yep, and we can alternate sides, yes.
Say it again. Push.
Good.
Okay. Here.
And as you start getting stronger, you'll be able to hold this position a little bit longer.
And come back down.
Relax on me.
You sinking just a little bit.
Come on down. Let's see, relax the shoulders all the way off. All right. First, let me gently pull the belly button in because you feel your low back helping you a lot.
Oh, yeah.
Yep. Gently pull that belly button in. Relax those shoulders down. Good. Now push the shoulders forward.
Relax your shoulder.
Good. And now pick one arm up. Don't drop through here. And you feel your body want to rotate just a tad. Yep. Come on down. So that there's just let your body let you know I'm just not quite there yet. Okay. But that's good. That's good because you were able to correct. A lot of times people have a problem whenever I correct the low back. People have a problem the moment they do this, they start doing this. Your compensation was not this, but your body was like, I'm gonna hold everything, but
Rotate, yeah, to the side.
And that's not bad at all. What that's telling us is that you probably can start here and just not put the best high right now.
Okay.
Yep. And it's not uncommon to see an imbalance from side to side. You got this, young lady? All right, let's take a look at Corlette over here. What you got over here?
Please tell it, because it felt a little too easy just now, so I'm like, I gotta put this on.
Do tell shoulders just might be together.
And now punch the shoulders forward. Oop, no, you feel yourself hiking them?
There you go. Come back down.
Good.
Rest. So after.
Good, that was the left side support you did.
Rest.
Good. You been practicing?
Good. It hasn't been that easy though.
Good, you showing
I
up.
was like, I'm doing something wrong.
No.
It's too easy.
The first thing I was the shoulders were high, but when we corrected that, you did it. Yeah.
But before you came, it wasn't hiking. I was like, I did it 3 times. I was like, I think I did it right.
No, it looked good. It looked good.
So like she said, for her.
Very good.
Lift up as high as-
It's a slight workout, isn't it?
Yeah.
Yeah, it's a slight workout.
yeah, it's a burn.
Hi.
Whole burn.
And y'all can take a break. Take a break. Yeah, take a break. So here's my disclaimer. You probably will be sore tomorrow. You probably feel like you had a workout, and you're probably thinking, but I haven't done much. But you have. You really have. Learning how to properly use the muscles at this baseline level is so very important. So that way you can get back to being, you know, Serena Williams out there on a tennis court. If that's what you want to do. I don't, but go for it. But it's a process, and it does take time. But these simple things are the things I typically have to teach people in the beginning when they're looking to try to retrain the diastasis. And now people typically ask me, so when am I ready for planks? And that depends. Are you able to control these basic movements? Are you able to do a plank where you're not getting that doming, or you're not holding your breath, or clenching everything else? Because if you're constantly clenching your butt, has everyone ever been to the park and seen the I just had a baby posture? Has anyone ever caught themselves doing the I just had a baby posture? Relax the butt. Relax the butt, okay? So if you don't want you standing here, you're relying on this to squeeze, and a lot of times it's because those glutes are weak. A lot of times it's because your pelvic floor is weak. And guess what now is being stretched out? Those muscles that you're trying to get to work a bit more, okay? So avoid the I just had a baby posture. And now you also have to avoid the other posture. I'm 95 years old. Okay? Avoid that posture as well. Same thing. Now at this point, I'm getting a lot of tightness through here. So people are, oh, my core is strong. Is your core strong, or is it just tight? Because it actually may not be strong, it may just be tight. In addition to that, if you notice my knees are bent, my hamstrings are probably tight as well. So you do want to try to make sure you're watching your posture. It will not only help with your diastasis, it will not only help with your pelvic floor, but it also will help long term with your actual bone and muscle health itself, okay? So do please make sure watching that posture, making sure that you're doing the basic things to progress to doing those planks, to be able to progress to doing the what people consider core strengthening as far as your crunches and those things. Because crunches are great, but you have other muscles that are forgotten about. Those obliques are forgotten about. That transverse are forgotten about. And the purpose of us doing this right now is to try to help better engage those forgotten muscles. So what questions do y'all have for me?
What is too much? Like, should we be doing these daily?
Great question.
How long?
Great question.
Yeah.
Every day. Every day, yep, every day, because you want to stay consistent, and people typically ask me how long. I don't want you going to the point to where you feel exhausted or fatigued. So with some individuals, your stopping point may be doing 3 of those on each side, and your body may say that's it. And then later on, you can do another set. So if you're doing like about 3 at a time, then try to do 2 to 3 sets of those a day. Now, if you're someone who's decided they're going to push through any and everything, I'm actually going to ask you to scale back a lot. Just so that way you can listen to your body and respond to your body, because your stomach is also communicating with you. If you're getting that doming, your stomach is saying you don't have this under control. If you're noticing that you're having pressure or even heaviness below, you don't have it under control, and you need to stop at that point, allow for things to recover, and even sometimes if you're able to regroup and try later on that day, you may not be able to do as much. So the number of how many really does vary from person to person, but gauge your body. If you're noticing, okay, I feel a slight burn, a little fatigue, that's your point. Take a break, see if you're able to do another set. If not, that's okay. Try again later on. If, however, you're having those signs where you're getting that doming or the pressure, like I said, that's an automatic stop. That's an automatic stop, because what we don't want as you're retraining things, we don't want for you to actually cause other issues. So if you're someone who's doing planks, one thing I tell you is to modify it. Start off at the wall. Nothing wrong with doing planks at the wall. You can also get good serratus punch planks at the wall, what we just did. If you're able to tolerate that, okay. Then move to the countertop. Let the kids crawl underneath you, they'll think it's fun. Yeah, move it to the countertop, and then start progressing way back down to the ground. But we try to jump back into the fitness program a little too soon and too heavy, and we forget about the basic muscles. But even with us mentioning your core, don't forget your hips and your legs. Think about all the motions you have to do every day that are functional, that require you to have a good core and also a good pelvic floor, which is part of your core. Your toddler's crying, you gotta pick the baby up. You grocery shopping, you gotta pick the bag up. So all those different functional movements, those are times for you to actually engage those muscles. Those are times for you to say, okay, you know what? I'm picking the baby up, let me squat down. Okay, the effort now is gonna come as I come up. Inhale, exhale as I come up. That way now you're able to engage your pelvic floor, able to engage the deeper core itself. So you're working out throughout the day, you just don't know it. And a lot of times people don't know how to properly implement the breathing with it. So the exhale comes on effort. The baby effort, picking the baby up, that's the effort part. Sometimes putting the baby down is the effort part. So whenever it's exerting more energy for you, that's when I want you to focus on that exhale, so that way you can better engage your core, your deeper core muscles. No, great question.
So to clarify, exhale doesn't necessarily mean hold your breath. Like you
It does
can
not.
exhale and then inhale, like as you're exerting effort, like.
Yes, great question. So with the exhale itself, for instance, like right now, I'm pretending I'm squatting. So I'm going down, I'm inhaling, exhaling. Now if I'm having to do that several times, and I'm going to continue to exhale. Now if I'm coming down and I'm having to hold that position,
That's
just so
where I go wrong right
yeah,
here.
just so that way I can continue to breathe. Otherwise, if you're just holding that pressure, you're causing a lot of pressure in here. You're causing all that pressure tension in here. Guess where it's going? That pelvic floor. So now your pelvic floor is trying to tense up and trying to help you fight. It's going to eventually give out. It's not made to sustain that type of load. And the way it tells us that it's giving out is because now you're having pain when you have sex. Now you're having incontinence. Now you can't control gas. Now you're just having random pains and you can't figure out where they're coming from. And sometimes even people don't realize, but sometimes back pain and hip pain is related to the pelvic floor. So breathing, you should not have to hold your breath to exert energy. And also, if you are doing heavy weight training, sometimes you want to cut back on your weights before you actually progress to that back to that weight. There are certain weights and certain weightlifting techniques where your breathing does change in response to that. And I'm not addressing that right now, just simply because it is a different type of breathing mechanics. Because you will see some of the bodybuilders hold their breath to exert that type of energy, and that is completely different with this. Yeah. What other questions y'all got for me? Any concerns for me?
Just have to practice the breathing, because that's my thing too. I hold my breath. So even when we're doing the shoulders here, I was like trying to like keep breathing, but I was wanting to hold my breath. So.
And one thing I tell people all the time is with the breath holding, even at home, take a seat in the chair, go to stand up. What do? If you hold your breath to stand up, your body's cheating, because your body is using your breath hold to activate the core versus using your muscle. Because you should not have to hold your breath to stand up. Yep. And at home, if y'all have any questions, please feel free to send us emails or even directly message us. That way we can make sure we get your questions answered as well.
Do you have like a particular style of exercise that you would encourage someone who has diastasis recti to avoid, or to like kickboxing or Pilates?
No, I tell people to avoid the exercises that they're not ready for.
Okay.
So that brings it back to what exercises are safe for diastasis. It depends on you. Yeah, it depends on you. So am I saying that you can't do kickboxing? I may say let's hold off on kickboxing, or at least hold off on certain moves for a few weeks. Let's get you stronger and then re-engage those moves. Am I saying that that you can't do CrossFit? It may be the same response. And also maybe, hey, you know what? Even if you get back to CrossFit full time, something like that, it may be decreasing the load. I know they said that's the workout. This is your load max though. Just so that way you can better tailor it to you. Because every individual, as you can see, just with the different integration of the exercise and how you can progress those, everyone's gonna respond a little differently. And then some people, even if they're able to get good control, they still may have more laxity compared to someone else. So I would never tell anyone just completely stop, don't ever consider it again. Let's see what we can do to get you back. Yeah, let's see what we can do to get you back to that.
This may be random,
No.
but since we are talking about the Kegels, I know I've heard that people doing a bunch of Kegels can cause more damage than not, but they tell you that after you have a baby that you should do them to help the pelvic floor.
Yes and no.
Okay.
What I say, and the reason why Lexi's laughing is because we hear this all the time. Patients come, my doctor said I just need to keep doing more Kegels. Okay, so why? Because I'm having this issue. Well, are you having that issue because those muscles are too tight, or because those muscles are too weak?
Gotcha.
Because I have women who come in, they're like, yeah, well, especially when it comes to intercourse itself, they're like, I can't have an orgasm. Is it because the muscles are too tight? Because the muscles are too weak. All of a sudden I feel like I'm leaking, I'm urinating myself. Same thing, muscles too tight or are they too weak? So it really does take an assessment. And the assessment itself can be performed externally and or internally. I do both. Of course, it's based upon the patient's comfort level, because I some people, based upon history and or just their comfort, they're not comfortable doing internal. I will get more information with the internal, but that's not at all saying that we can't help you progress with it solely external as well. So can it help? Yes, maybe. It depends if it's right for you.
Okay.
I know that's like the terrible answer when it comes to physical therapy. People are like, well, it depends. It really does, because like I hate giving, this will fix everything, because you're an individual and you should be treated as such. Even your healthcare, everything you receive should be treated as such. Your workout plan should be treated as such. So you want to make sure that you're getting what you particularly need. I could give you a standalone that covers all, and then you'd be like, well, it didn't work for me, because it probably wasn't meant for you.
Gotcha.
Yeah. Well, no, thank y'all so much for coming out. This was fun. I typically try to do a workshop a few times a year. This is our first one for this year, our second one total. So we'll probably be having a few more this year. So stay tuned, stay posted. Also, if y'all have any questions, you have any concerns, everyone who did come, I do wellness visits and also physical therapy as well. Everything we just did is covered underneath wellness. So you all will be receiving a discount code from me, so that way if you all want to pursue wellness with me, you'll be able to do so. And also I've had some requests, so if I get enough people, we'll also consider wellness groups, in person, small number, and then same thing in person, virtually, small number virtually as well. So yeah, just y'all let me know. My goal is to make sure that you all can get the education and knowledge that you need, so that way you can have a better life enjoyment. Because these are issues that unfortunately we as women have had to deal with, and no one has really cared about and just told us they're normal, and we should not have to suffer like this. So if y'all have questions, you have concerns, please let me know. Also, you can let Dr. Lexi know as well. Thank you for your help today.
No.
Awesome. Well, thank y'all. And online, thank you for joining us as well. Like I said, you all will be getting a video of how to do a self-assessment, and also the handout that everyone received here today. So thank you all so much. If you have questions, let us know.
Teach us the videos.
But y'all also, y'all will be getting a self-assessment video via email, just in case you forget how to do it. You can do it again. And you also will be getting like the coupon network if you want that. But most importantly, if y'all have a friend that is saying, hey, I'm having this going on, tell them to go see a pelvic floor therapist.
Tell them to go see a pelvic floor therapist.
Please tell them, because after 6 weeks postpartum check, if it's your first baby or fifth, oh, so you know.
They're not telling you nothing.
They don't tell you anything, so you're good to go.
Yeah.
Do those candles.
but you're not, so, yeah, so please, the biggest thing, I just wanna make sure you get the care that you need. So if you have questions, you have concerns,
My
feel free to
sister
reach
said
out.
Yes, my sister's a physical therapist.
Awesome.
And she was like, you need to go see this seminar. She said, go right. Go right to the Lord. It's on the internet. I was
Well,
like,
tell her I said thank you.